My name is Dr. Madhuri Gandhi. I'm an IVF consultant in Curio Hospital. I've been in practice since past 25 years. Today I'm going to discuss about evaluation of infertile couple. When the infertility is described as inability to conceive for 1 year or more than 1 year in spite of unprotected sex and a time sex. So when the patient comes to you, to your OPD, first you start with the history of the patients. You ask about how much is the age of the couple. In case of a female patient, because if age is more than 35 years, the egg quality declines. In case of a male patient, if age is more than 40 years, the sperm quality declines. Even the genetic constituents of egg and the sperm also get hampered. Then ask about how many years they have been married. Then ask about any medical treatment they have taken prior to this. In case of a female patient, ask about the menstrual history, whether her cycles are regular or irregular, whether her menstrual flow is normal. Ask her about any past medical history like tuberculosis or endometriosis. Ask her about the present medical history, whether she is suffering from hypertension or diabetes, any medication she is taking. Then ask her about any previous surgeries done. Ask her about any abdominal surgeries or any cervical dilatation, past history of cervical dilatation, as it can cause the endometrial adhesions. Then comes the examination of the female patient. First you do the first speculum examination. In that case, you see whether the patient has any vaginal discharge or a vaginitis or a cervical erosion. Then comes ultrasonography. In ultrasonography, you first look for the ovaries. In ovaries, you check for antral follicular count. You check for any endometrial cyst or any normal cyst. Then you come to the body of the uterus. In the uterus, you look for the endometrial lining. In endometrial lining, you look for whether it is a triple layer endometrium, whether the endometrium is shaggy. The shaggy endometrium can be due to interendometrial adhesions. Then you see for any polyp or a septum. In case of a myometrium, you look for the fibroid or adenomyosis. All these factors should be seen as it affects the implantation of the embryo. Then you look for the hydrosalpinx. Hydrosalpinx means there is a fluid in the both fallopian tubes. This is also to be checked because if you not check this, the fluid in the fallopian tubes comes in the endometrial cavity and hampers the implantation of the embryo. Then you check for in case of ultrasonography, in ovulation induction cycle, you can also check the follicular growth, how the ovaries are responding, whether the egg is rupturing after the trigger injection. Then comes your patency of the fallopian tubes. This can be checked on the OPD basis also. By this, this can be done with the two methods, the sonosalpingography and the hysterosalpingography. In sonosalpingography, the saline is injected. The patient is called on the day 8 of her menstrual cycle. The saline is injected through the cervix and the flow of the saline is checked by the sonography or abdominally. Whether the saline, and we check the patency of the fallopian tubes. In case of hysterosalpingography, the radioactive dye is injected in the uterus and the X-ray are taken and we see whether the bilateral spill is present in the fallopian tubes. And the last comes to a laparoscopy and the hysteroscopy. This is an invasive procedures. Now in case of a male partner, in a male partner, again you ask the history about the age, how is his lifestyle, whether he is smoking, alcoholic, how is his work, whether it is a sedentary kind of a work, whether he is working near the heat. Then comes your semen analysis. In case of semen analysis, you have to check for the volume, the pH, then the sperm count and how much is the motility. In case of motility, you have to check for the rapid progressive motility and the slow progressive motility. The rapid progressive motility and the slow progressive motility should be more than 50%. Then comes your morphology of the sperm. In morphology, you have to check for the head, neck or the defects. If the defects are more, then tell the patient to go for sperm fragmentation test. Now comes to the blood test. The blood test, first I talk about the female, in case of a female partner. The most important hormones in the female partners we check is FSH and LH, serum prolactin, TSH and AMH. The FSH test is done on the day 2 or a day 3 of the cycle. FSH means the follicular stimulating hormone. This hormone is required for the recruitment of the follicles and the growth of the follicles. If FSH is on day 2, level is more than 10, then the patient will be poor responder, she has a low ovarian reserve and her egg quality will be the poor. LH test is also done on day 2 and day 3, or it is done on between day 14 and day 28 of the menstrual cycle. If LH is a luteinizing hormone, it is responsible for the ovulation of the or a maturation of the oocyte. Now, if day 2 or a day 3 LH is high, then it is due to the hormone imbalance like polycystic ovarian disease. If between the day 14 to day 28, if the LH hormone indicates about the ovulation, then comes your serum prolactin levels and the thyroid stimulating hormone. This test should be done because it also affects the fertility of the patient. The antevenereal hormone is a hormone which is secreted by the antral follicles, and this is a hormone which indicates how much is the ovarian reserve and also indicates the quality of the egg. If AMH is low, then that patient has a low ovarian reserve and a low egg quality. Then we also do the karyotyping. It is a basic karyotyping of the female partner. Now, in case of a male partner, some blood tests like we have to do again. The FSH and LH will determine how much is the sperm count. LH also determines the testosterone amount produced in the male partner. Also, if the patient has the erectile dysfunction or a low sex desire, then you have to do the serum prolactin test and the sugar test to rule out the diabetes. After doing all the tests and this thing, we will treat accordingly the patients, whether the patient will go for an IUI or the patient needs IVF. Thank you very much.